Hi everyone. So today's session is about mood disorder. So as you all heard what is mood. So mood is a kind of state of mind, the way we react to the situation, the way we react to the people. So that is called as mood. Okay? It is a state of our mind. So what is mood disorder? Mood disorder is fluctuations in the mood or variations in the mood. So without any proper triggers, without any proper reasons, without any serious issues, there will be changes in the mood. At times a person get into depression, at times a person get into mania. That is called mood disorder. In the mood there is another thing which is affect, AFFECT. So affect is something which is there for a short term. It is called short term mood also. So mood is there for a long term, and which is as a because of the result of that mood with something, a state of mind which is there, that is for a short term, that is called affect. So for example, being sad is a mood, crying is a affect, it is a result of that particular sad mood. So being happy is a mood, laughing is a affect. So hopefully you understand the difference between affect and mood. Mood is for a long term and affect is for a short term. Now we will see what are the different names for mood disorders. So mood disorders are called by different names like MDP, MDD, and bipolar affective disorder, BPAD. So manic depressive psychosis is, it's about the mania and about the depression, and at times there will be psychotic symptoms also. That's why it is MDP. Manic depressive disorder, because mood disorder has two episodes, so they call it as manic depressive disorder. And also it is, the recent name of mood disorder is bipolar affective disorder. That means in a pole, so there will be two ends. So one end is one episode, another end is another episode. So one is depression and another one is mania. So bipolar affect is a type of a mood. So bipolar affective disorder. So all three names are used to call mood disorders. Okay. Now we'll see episodes. So to call a person is having mood disorder, he should have these two episodes. One is depression and another one is mania. But he will be getting these episodes on and off, not because of any serious issues, maybe because of a biochemical imbalance. So we'll see what is depression. So in depression, the person will be inactive, person will be dull, depressed, he will be having crying spells for no reason, feeling helpless, having hopeless situation, being worthless, and most of the time he speaks about suicide. So suicidal talks will be there, suicidal thoughts will be there, and also attempts. That is characters of depression. And the characters of mania are being overly excited, overactive. So inactive is in depression and overactive in mania. Dull and depressed in depression and excitement in mania. So being very dull, being very inactive, being very lazy in depression, being restlessness. So like he cannot sit at one place, he will be always walking, roaming here and there, talking something or the other. He will not finish one work completely. He will be going for many different kinds of work and does everything incomplete. So being very restless and having a blissful situation. He thinks he is at heaven, like he has no issues. He has a very good life. He is very happy person. So comparatively, there is nobody, like his happiness cannot be compared to anybody. So he feels he is at a blissful situation and grandiosity. So he'll be having superiority complex. He feels he is overly intelligent, overly rich, and he can help anybody, just simply giving, donating everything whatever he has at home. So grandiose ideas will be there and dominating behavior will be there. So because of grandiose ideas, because of superiority complex, he will be having domination also. At times it will end up with the anger, aggression, and fights also. Now we'll see the causes of mood disorder, that is heredity, and most of the time it is because of biochemical imbalance. So imbalance in biochemicals at times leads to depression, at times leads to mania. So we need to give a medication to handle these biochemicals normally, like to make a secretion of biochemical normal. So medicines are given, and few of the psychological factors also contributes to mood disorder. Along with that, social factors, maybe unemployment, poverty, maybe some stress, family issues also leads to mood disorder. Okay. So treatment, finally the treatment will helpful for the person to overcome mood disorder. So first one is medicines. Mainly medicines are given to balance the biochemical secretion. Next, yoga and meditation. It is mainly for manic people. Those are very restless. So for them, yoga and meditation will make them calm, will help them to divert their attention towards the positivity, and will help them their physical activity towards the physical energy towards the positivity. So meditations also very much important. And supportive therapy is based on his hobbies and interest. These therapies can be planned. Along with that, counseling, because counseling is individual counseling, group counseling, family counseling, couple counseling, also helpful for the person who is having mood disorder. At the end, psychoeducation, like educating him about the mood disorder, will also help the person to overcome his problem, and he can control few of the symptoms, knowing that it is a kind of psychiatric disorder and it will be better because of medication. So this is about the mood disorder session. Hopefully this session was helpful for you, and if you find our videos useful, please subscribe to our channel and share among your friends and family groups. Thank you so much.